Let me ask you something. How long have you been sitting today? I don't mean just right now watching this video, I mean total. Your commute, your desk, your couch, your dinner table. Add it up. For most Americans, that number is somewhere between 8 and 12 hours every single day. And here's the thing nobody's telling you. Your spine doesn't care that you're uncomfortable. It doesn't care that your chair has lumbar support or that your monitor is at eye level. What it cares about is load, pressure, position. And when you sit, especially the way most people sit, you are loading your spine in a way it was never designed to handle, for hours at a time. I'm Dr. Hymas. I'm a chiropractor here in Pahrump, Nevada. I work out of Safe Harbor Medical. And today I'm going to show you exactly what is happening inside your spine while you sit. Not in vague terms, not in medical jargon. I'm going to show you the actual mechanics so that by the end of this video, you understand why your back hurts, why it's getting worse, and what you can actually do about it. So this is a healthy spine in a standing position. Notice the three natural curves. The inward curve at your neck called the cervical lordosis, the outward curve in your mid-back called the thoracic kyphosis, and the inward curve in your lower back called the lumbar lordosis. There will be a test. Just teasing. These three curves work together as a shock absorption system. They distribute the weight of your head, your torso, your arms across the entire length of the spine rather than concentrating it in any one spot. This is engineering, millions of years of it, and it works beautifully when you're moving. This is what happens when you sit, especially after the first 20 or 30 minutes when you stop thinking about posture and your body just does what's comfortable. The lumbar curve flattens out or reverses entirely, the thoracic spine rounds forward, and the head, your head weighs between 10 and 12 pounds in a neutral position, starts to drift forward. Every inch your head moves forward of your shoulders adds roughly 10 pounds of effective load on your cervical spine. 2 inches forward, that's 30 pounds of extra pressure on your neck. 3 inches, closer to 40. You are essentially carrying an extra bowling ball on your neck just by looking at a screen. Now let's zoom in on what's actually happening to your discs. Your intervertebral discs are the shock absorbers between each vertebra. They have a tough fibrous outer ring called the annulus fibrosus and a soft gel-like center called the nucleus pulposus. Think of it like a jelly donut. In a healthy upright posture, the pressure is distributed evenly across the disc. The jelly stays in the middle where it belongs. When you slump forward in a chair, the front of the disc gets compressed, the donut gets squeezed from the front. That forces the jelly, the nucleus, to push backwards towards the spinal canal. Over time, with repeated sustained compression, that outer ring can crack, weaken, and eventually allow the nucleus to push through. That's a herniated disc. And the nerve roots that exit your spinal canal right there at that level are exactly where that disc material is heading. That's not a scare tactic, that's anatomy. When that happens at the lower lumbar levels, which is where sitting creates the most compression, that nerve doesn't just cause back pain. It follows a pathway down through your hip, your glute, down the back or side of your leg, sometimes all the way to your foot. That sciatica, that burning, shooting, sometimes electric pain down the leg that millions of people are suffering with right now. A significant portion of those cases trace directly back to the sustained sitting in poor posture over months and years. Now I want to talk about something that doesn't get nearly enough attention, what sitting does above the shoulders. We talked about forward head posture already, but I want to make sure this lands because it's the source of more headaches, more neck pain, more upper back tightness than almost anything else I see in my practice. The muscles at the back of your neck, your suboccipitals, your levator scapula, your upper trapezius, are working constantly to hold your head up in neutral posture that's manageable. That's what they're designed for. But when your head drifts forward, these muscles are now holding that extra load at a mechanical disadvantage. They're working overtime for 8 hours a day. Of course they're tight. Of course they're triggering headaches. Of course your upper back feels like a board by the end of the workday. Your muscles are exhausted from doing a job they were never supposed to do for that long. Here's one more thing that sitting does that almost nobody talks about. It compresses your thoracic spine, which rounds your mid-back forward, which closes down your rib cage, which directly restricts your diaphragm. Your diaphragm is your primary breathing muscle. When it can't fully expand, you take shallower breaths. Shallower breaths mean less oxygen per breath, which means your body responds by breathing faster, which activates your sympathetic nervous system, your fight or flight response. People wonder why they feel anxious and fatigued sitting at a desk all day. Part of it is genuinely mechanical. Your posture is affecting your breathing, which is affecting your nervous system state. This is not abstract, this is physiology. So what do you actually do about it? I'm not going to tell you to just sit up straight because you already know that, and it clearly hasn't solved that problem. Willpower isn't a posture correction strategy. Here's what actually works. First, break up your sitting. The research is consistent on this. Getting up and moving even 2 to 5 minutes every 30 minutes significantly reduces the compressive load on your discs and allows the nucleus to rehydrate and reposition. Set a timer, stand up, walk to the water cooler, do 5 minutes of anything that isn't sitting. This single habit change reduces your disc injury dramatically. Second, strengthen your posterior chain. Your glutes, your hamstrings, your lower back extensors. These muscles are what maintain your lumbar curve when you sit. When they're weak and inhibited, which happens when you sit on them for 10 hours a day, they stop doing their job and your spine has to compensate. Squats, deadlifts, hip hinges. You don't need a gym membership. You need to put your body in positions that counteract what your chair is doing to you. Third, get your spine checked. I know, I'm a chiropractor saying this, so take it for what it is. But the structural changes that develop from years of poor sitting posture don't resolve on their own. The disc dehydration, the facet joint irritation, the muscle imbalances, early postural changes. These are things I see every day in my office that people have been living with and compensating around for years before they finally come in. By the time there's significant pain, the problem has usually been building for a long time. So if you're in the Pahrump Valley and you've been sitting at a desk or behind a wheel for years and your back, neck, or hips are starting to talk to you, come in. We'll take a look at where your spine actually is right now, not where you assume it is. Your spine kept you moving today. Every hour you sat, it absorbed the load, compensated for the position, and kept you functional. That's what it does. But it's not invincible, and it's not self-correcting without some help. The good news is that most of what I described today is addressable. The disc changes, the postural shifts, the muscle imbalances, but the right care and the right habits for improvement is possible at almost any stage. Take care of your spine. It's the only one you've got. Again, I'm Dr. Hymas. I am a Pahrump chiropractor. I work out of Safe Harbor Medical. You can call us at the number listed below. And until next time, be good.